The burden of breast cancer is rising worldwide. However, in 2020, it was the most common cancer, overtaking lung cancer for the first time in decades, with 70% of cases indeed in countries of limited resources. Compare this to 60% in 2008. So it's a 10% increment in the proportion of women affected in countries of limited resources, with a disproportionate increase in mortality. 60% of the mortality attributed to breast cancer worldwide is indeed in countries of limited income, compared to a 50% proportion a decade ago. So it's a rising problem. More important is the proportion of women diagnosed at age younger than 50. 50% of women diagnosed with breast cancer in countries of limited resources are younger than age 50. They are premenopausal, compared to less than 20% in countries of high income. So that adds to the burden of breast cancer in these countries. Those are young women in the prime time of their lifetime. They are tending for children, for families. They are working moms, working ladies with a lot of burden, and quite important for the society, not only for their families. In addition, that's another economic burden, not only attributed to the woman herself affected, and excuse me, men are affected as well, but they are only 1% as compared to total population of patients with breast cancer, but also the family, the productivity loss of the family, the caregivers, the family members tending for the woman during their treatment journey. We always talk about early detection, but the first priority is to address the trend, the rising trend for the burden of breast cancer. The most widely cited reason is indeed westernizing women risk. That has been talked about for the past couple of decades, but hasn't been really highlighted in awareness campaigns. We know that westernizing women risk is really associated with desirable changes of improving socioeconomic status, more control of her life, but also it comes with more sedentary lifestyle, bad dietary habits or poor dietary habits, less breastfeeding, more smoking, and unfortunately, more drinking lately. All these increase the risk for pre and postmenopausal breast cancer. And indeed, you'd be surprised if I tell you the proportion of women with obesity, the highest increase has been documented in countries of Africa, Southeast Asia, and Middle East, the same countries where you have the highest rise in the incidence of breast cancer. We need to talk about this in awareness campaigns and highlight it as a modifiable risk factor. In addition to early detection, and I'm not talking about national screening mammography, I'm talking about awareness about the importance of early detection, excellent outcome when it's early detected, and limited morbidity of interventions when it's detected early, because women are more scared about the intervention rather than disease itself. And also quite important to talk about, let's say, practical diagnostics. We do not need to have everything in place before we address diagnostic mammography, or at least the status of the estrogen receptor for a woman recently diagnosed with breast cancer, which cannot be indeed identified in some countries as we speak right now. We do not need to have perfect radiology service in place, perfect pathology service in place. We need to tackle those factors that could improve outcome with rapid diagnostics that are simple and affordable. We need to address also certain elements of multidisciplinary care. We need to highlight the importance of resource stratified interventions. We need to talk about access to therapeutics. Access to therapeutics in terms of facilitating drug approval process, in terms of pricing, but very important, access to therapeutics could be even improved in countries of limited resources through access programs and clinical trials. We need to talk about more clinical trials in countries of limited resources, simply because they create excellent infrastructure to improve healthcare. They train health personnel, they improve patient outcome, they actually cut down the cost and facilitate access to excellent recent therapeutics at a minimum cost for the global community. They help facilitate the completion of trials in a cost-effective manner, also facilitate quick approval for new options. In addition, they verify the results in different ethnic groups and also teach us about drug metabolism in different ethnic groups. That's why addressing clinical trials, particularly those that are associated with optimization regimens or de-escalating regimens, quite important in countries of limited resources. They are being done in high-income countries. I wonder why not talk about it in countries of limited resources. There will be a debate entitled, can we afford the price of recently approved targeted therapeutics in actually not only in countries of limited resources, it's actually globally. And that's quite important because we do have many new drugs approved lately over the past couple of years. They make a huge difference. They impact overall survival. Women with metastatic breast cancer these days could survive potentially a median of 5 years, so up to 10 years even with new therapeutics. But they will not be able to survive that long without access to drugs. They are priced at a very high cost, out of reach for many women around the globe. Even in high-income countries, if they're not insured, they cannot access those. So what's the point of innovation if it cannot improve survival? And that will be the subject of the debate. It will be between Richard Sullivan and Alex Inyu. And I very much look forward to moderating this debate and for the discussion that would follow. You know, you'd be surprised how many groups are trying to facilitate access to drugs around the globe. We have many organizations with, they have to be commended for what they're doing. Max Foundation managed to get Gleevec, a drug that it's considered a miracle for patients with chronic myelogenous leukemia, for 35,000 patients around the globe free of charge. Can you imagine? And remember, chronic myelogenous leukemia is a rare disease. So when I said 35,000 patients and probably even more, that's a huge proportion of those patients. That's Max Foundation by itself. We have Atom, and I don't want to forget other initiatives, but we do have a lot of initiatives. And indeed, ASCO this year managed to convene so many of those groups together under initiative for improving access to oncology medications around the globe. So let's hope for the future.